I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. This edition of Health Inspired Talk is a special one. We're excited to share the final stages of a project 2 years in the making. In fall 2021, we embarked on a $100 million modernization of ThedaCare Regional Medical Center-Neenah. The project is nearing completion, and today we are giving you a glimpse inside the new space ahead of an upcoming community and team member open house. We call the modernization Inspired Past, Healthier Future. It's a nod to the proud history in the community that ThedaCare has come to be thanks to the generosity of Theda Clark Peters, whose gift to the community in 1903 planted a seed that has continued to grow for more than a century. Today, we're delighted to share the latest milestone in ThedaCare's legacy. So let's take a look inside. Joining us first is Lynn Detterman, Senior Vice President of the ThedaCare South Region. Lynn, thanks for being with us.
Thank you for having me.
So we're talking about the modernization project. We're nearing completion. This has been an incredible project. Can you just give us some highlights of the modernization?
When we set out to do this project, we knew that every decision we were making was going to put the patient and their family in the center. And then we also wanted to align our strategic goals with whatever we were accomplishing in this project. The first was our emergency department. We had outgrown our previous emergency department, and we needed to enhance our trauma rooms and just the overall experience for our patients. We also knew that we wanted to create space for a graduate medical education program so that we could begin our residency program and train physicians for generations to come. And then we also knew that we wanted to completely renovate our surgery department by adding also a 4-room robotic suite, because Neenah is best of class in robotic surgery. And then also we completely overhauled our inpatient behavioral health services. Not to mention various other areas such as OB and PT and OT, and then the list goes on and on.
So one of the areas that people will really notice when they walk right in is that main area. It looks completely different than what it used to. What was the thought behind the design?
Our previous main hallway of the hospital was a dark, narrow corridor, and we knew we wanted to completely overhaul that experience for our patients. And so now when you come into the space, it's open, there's natural light, there's high ceilings, and we've added a retail pharmacy, open 7 days a week with a pharmacist on duty. We have our gift gallery, and then we also have our fresh market. So our cafeteria has now moved from the basement onto the first floor, easy to access. But what we do the most of every day are our diagnostic and our lab. And so we wanted to move those very accessible to the main entrance of the hospital. Some of those services were on the second floor and down corridors that were hard to find. Now all of that is front and center.
Oh, so easy for patients. Another space that I think really stands out is the Women's Center. That is beautiful. What was the process like, and what kind of sets that Women's Center apart?
A lot of women know that it's very important to get their annual mammogram, and sometimes it's not the most comfortable test. And so we wanted a spa-like experience, the least we can do when you're coming in for your mammogram. But we also wanted to create a women's center, so we have our ultrasound services as well as our bone density services there as well.
Another area that has been updated, physical, occupational, speech therapy. It's very unique, very different. What are some of the features of that?
Yeah, so our previous space was really undersized, and it was actually tucked away far back into the corner of the hospital, so it was really tricky for patients to maneuver back there. Now it's in the front of the hospital in our medical office building, and the space is spacious. There's natural light coming in. There is a driving simulator, so patients that have had a traumatic brain injury, then as they regain skills, need to also relearn how to drive. And so it's a way for them to be able to achieve that goal.
Now, this is taking place here at the Neenah campus, but the modernization can truly benefit all of our hospitals, the critical access hospitals, and patients in our other communities. How does that play a role here at this campus where it's still connecting all the other services that we provide?
Absolutely. So we are the regional trauma center, and so obviously we receive patients from all of our outlying hospitals. Now with an expanded emergency department, we now have 3 trauma rooms. and including a CT that's adjacent to one of those trauma rooms. We have our new comprehensive stroke equipment, so we have a new biplane, again, serving the region. And we can't forget our new GME space. And so we will be starting a residency program here for a graduate medical education, and we will be training physicians for generations to come.
That's incredible. Thank you, Lynn, so much for being with us and helping us understand the modernization.
Absolutely, thank you.
Joining us next is Dr. Ray Georgen, a general surgeon who's worked with ThedaCare for more than 3 decades. Dr. Georgen, you have a unique perspective when it comes to the modernization.
I do. I've been around for a while, and this building project has been so exciting from a clinician point of view. You know, I think about how our trauma program started back in 1990 and where it is as of now, which is fantastic, and probably one of the most limiting steps for us was space. And this building project really helps our emergency room folks deal with not only trauma patients, but everything that comes in the emergency room.
And speaking of trauma, you helped bring the Level 2 Trauma Center to this campus here at Neenah. That includes ThedaStar. It created a tremendous legacy. Why was the update to the trauma center so necessary?
Really, any bad trauma that happens within, say, 60 miles, it's coming to Neenah. And by having ThedaStar, which basically is the handshake to our trauma program, where our unbelievably well-trained flight nurses can start providing care in the field or from a referring hospital to get the care going and bringing these patients back here to the most modern facility you can have is just a huge benefit to members of our community who are injured.
Part of the modernization includes enhancements to the robotic surgery program. So how does that expand our capabilities?
We've really embraced this new technology, which is an enormous benefit to patients. Length of stay, less pain, getting back to work, all those things are enhanced by the robotic technology. And a story that a lot of people don't realize is that we are a national observation center in the United States. So surgeons will come here to be trained on robotic techniques that we do here every day. The other part of it is that we have surgical residents who will come here, and we're training the next generation of providers to have this technology, which will benefit hopefully those that will stay in our community or wherever they go.
Wonderful. Dr. Georgen, thanks for being with us.
Thanks for having me.
This modernization was made possible in part thanks to the generosity and support of businesses, organizations, and community members. Here to talk about the impact of that is Barbara Beuscher. She is the Chief Philanthropy Officer at ThedaCare. Barbara, thanks for being with us.
Thank you, Cass.
Now, you really can't overstate the importance of donors in this modernization project. Can you talk a little bit about the donor support?
We've had incredible support for this campaign, and it's come from many different sources. It's been individuals, corporations, foundations, but as well as our own team leaders, as well as team members. And the support has not only come from the Neenah community, it's come from throughout our region because they really see the impact of having a strong regional medical center, trauma level 2 here in Neenah.
Another area that we saw improve throughout the modernization is the inpatient behavioral health space. Why was that need so necessary?
That also was a space that our donors were eager to invest in. We were able to increase the number of rooms from 10 to 19, but also to have those spaces be private as well. And so we also were able to add communal space areas, craft and other areas that really then helped them with that experience while they're here during a vulnerable time in their life.
So another area that speaks directly to our legacy is the Family Birth Center. This went through another major update. Can you tell us a little bit about that part of the modernization?
So by having this modern birth center, it allows us to be able to welcome those beautiful little ones into the world in a modern setting, a comfortable setting, and all of those things that we want for our patients. We're also able to add an OBED, which is an obstetrics emergency department that really then deals with our patients through all of the stages of their pregnancy. So instead of going to the ER, they go directly to the OBED. Through the support of the Theda and Tamblyn Clark Smith Foundation, we were able to name that center in the honor of Theda Clark Peters, which has really been meaningful to all of us and really pulls our history and our mission and our founding all together.
That's wonderful. Anything else that you might want to share with us about the organizations and the people who have supported the modernization project?
Absolutely. I would just start with thank you. It's just been incredible again to see the support from so many individuals in so many ways really pulling this together. And so thank you. Thank you for investing in our mission, in our vision, allowing us to really allow our patients to live a life inspired.
All right, Barbara, thank you so much for being with us.
Great. Thank you.
To end our episode, we want to give a special shout out to our volunteers. Our dedicated and selfless volunteers helped ensure a seamless experience for our patients and visitors throughout the modernization, and we are grateful to them. To recognize this tremendous group of people, we wanted to hear from them in their own words about why they give back and what it means to them to see the modernization near completion.
My name is Ann Zolkuski.
My name is Greg Zielinski. Everybody calls me Hondo.
My name is Amelia Wasco.
I'm Nancy LaBeouf, and I'm a volunteer at ThedaCare for 46 plus years. At first, I was the information, and then I worked down by the lab and did drug kits, made those up, and now with the print job.
I'm a former employee in the clinic setting, so I came after retirement knowing that I wanted to be in the service community at ThedaCare and stay here.
My regular doctor sent me to cancer care in Appleton. I saw all these sick people, and I thought to myself, I want to help these people.
I started volunteering, I think, because I wanted to give back to this community. My dad works here, and I've grown up around this hospital.
With modernization, it's just been a joy. I see people in the hallway walking through. It's like there's just a spring in their step because it's just so beautiful.
The first time I went to ER, I couldn't believe it. I love the main street.
Have you seen any of the changes?
No.
And you can open them now. Oh my God. Woo. That is really different.
Modernizing the hospital just shows that we're committed. We're committed to really servicing our community.
It's good to see a change because I know it'll benefit others.
You're going to get the best care at this hospital.
I love the job. I love what I do. I'll do it as long as I possibly can.
Thanks for joining us for this special episode. To get a firsthand look at the modernization at ThedaCare Regional Medical Center-Neenah, join us at our community and team member open house. That's taking place from 5 to 8 p.m. on Thursday, January 18th. Visit ThedaCare.org/innovation to learn more. We'll see you then. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.